Bonjour, annyeonghaseyo, konnichiwa, sawadika. Good day at magandang araw sa aking mga ka-good vibes dyan! Kumusta kayo? It is finally time for our Genius R segment special for today, and we are going to be tackling about Rhinitis Medicamentosa. Reminder, bago tayo magsimula, make sure to find a quiet place and check your surroundings first. Pwede din kayong gumamit ng earphones, AirPods, or headphones so you can hear the whole session without any distractions better. If you guys are ready, without further ado, let me start my presentation. So in this lesson, we will tackle about the introduction, clinical manifestations, interventions and treatment, outlook, and lastly, conclusion of Rhinitis Medicamentosa. At the end of the slide, you'll see my references. Pwede nyong i-check yung citations ko if you like. So, introduction. What is the topic all about? I know some of you haven't heard the term Rhinitis Medicamentosa. So, ano nga bang Rhinitis Medicamentosa? Rhinitis Medicamentosa, also known as rebound nasal congestion, is commonly associated with overuse of over-the-counter nasal decongestants. Instead of making you feel better, the medication further irritates your nasal linings or nasal cavity. Rhinitis meaning the inflammation of the nose, while medicamentosa or medicamentus means relating to or caused by a medicament, which is also known as drug. If you combine the two words, it means inflammation of the nose caused by a medication. Having Rhinitis Medicamentosa is not common. You may be at risk if regular kang gumagamit ng nasal sprays or nasal drops like phenylephrine, oxymetazoline, or xylometazoline. These three medications are listed under topical decongestants, which reduce nasal congestion in both allergic and non-allergic rhinitis. Phenylephrine is a decongestant that is used to treat stuffy nose and sinus congestion caused by the common cold, hay fever, or other allergies. Oxymetazoline is a decongestant that shrinks blood vessels in the nasal passages. Dilated, meaning widened or expanded blood vessels can cause nasal congestion or stuffy nose. While xylometazoline nasal is a decongestant that also shrinks blood vessel in the nasal passages. Both oxymetazoline and xylometazoline are used for temporary relief of nasal congestion caused by allergies or the common cold. So, as you can see in this slide, you can see an example images of Rhinitis Medicamentosa. If you can look here in the circle, you'll see the inflammation or the swelling of the nose that actually leads to Rhinitis Medicamentosa. Next is clinical manifestations. So, paano mo nga ba malalaman if you're experiencing Rhinitis Medicamentosa? Topical therapy, which is yung paggamit nga ng nasal spray medication, is being used mostly by people na may common cold. They usually buy over-the-counter na nagpo-produce lang ng moderate clinical benefits, meaning katamtaman lang to relieve symptoms, since kapag may common cold ka, may possibility na mahirapan kang huminga dahil sa mucus or yung sipon na bumabara sa loob ng nose mo, right? You can use decongestants para mas makahinga ka ng maayos. Though nasal drops or nasal sprays can be useful, you still need to be aware of the effects na pwede mong ma-experience since once na you overused it, it will lead to Rhinitis Medicamentosa. Or just like I said earlier, inflammation of the nose caused by the use of decongestants. Congestion is usually the only symptom. And if you continue to use your nasal spray, this congestion can last for weeks or even months. Next is interventions and treatment. So ano ang pwede mong gawin to prevent Rhinitis Medicamentosa? First, You can read the label of the medication. Usually, may nakasulat na directions on how often and how long the medication can be used. Unless your physician says otherwise, follow the instructions on the label. Next is pay close attention din on how your symptoms change when using the congestant. If walang change, tell your physician sooner rather than later, baka makahanap agad ng relief that way. Lastly, you shouldn't skip nasal decongestants as a possible treatment for rhinitis out of fear of developing rhinitis medicamentosa. If you're otherwise able to use these medications, try them. Just be aware that they're for short-term use only. So, are there any treatments for rhinitis medicamentosa? There isn't really a test to formally diagnose rhinitis medicamentosa. But once you stop using the medication, it will eventually stop. Hindi ka pwede mag-stop agad-agad though, since it may lead to more swelling and congestion. There's a possibility na i-recommend sa'yo ng physician mo to gradually decrease the use of the medication. If your congestion is mild, your physician can recommend saline nasal spray, which contains only salt water solution. In more severe cases, they recommend prescription nasal glucocorticoids, a powerful medicine that reduces inflammation and congestion. If additional treatment is necessary, your physician may prescribe oral prednisone too, such as pseudoephedrine may also be helpful. Pseudoephedrine is used to relieve nasal congestion caused by cold or allergies. It can also relieve sinus congestion and pressure. Your physician may also consider surgery. For example, long-term congestion and inflammation can cause polyps, or abnormal tissue growths that most often look like small, flat bumps or tiny mushroom-like stuff, to form in your nasal cavity. Pwedeng mag-worsen yung symptoms, so surgery may offer relief. So next is the outlook. So when to seek a doctor? If nasuspect mo na may rhinitis medicamentosa ka, you should see a physician para ma-assess nila yung condition mo and para ma-help nilang ma-relieve symptoms mo. Reducing inflammation is important para maiwasan ng serious complications. It's not easy to diagnose rhinitis medicamentosa, since possible na hindi yung medication use ang problem. Baka mamaya, instead ng rhinitis medicamentosa, meron ka palang chronic rhinitis. Chronic means persistent or long-lasting. In other words, chronic rhinitis means persistent inflammation of the nose. Chronic inflammation can lead to polyps forming in your nasal cavity. Lastly, after your symptoms have cleared, you should talk with your doctor before using nasal decongestants for future bouts of hay fever. Hay fever means allergic rhinitis or other forms of rhinitis. Okay, conclusion. Again, rhinitis medicamentosa or the inflammation of the nose caused by overuse of nasal decongestant is not common, but that doesn't mean na hindi siya nag-exist. It occurs once nasobrahan ka sa paggamit ng nasal drops or nasal sprays. Make sure you read the label of the medications first to see how often and how long you can use it to prevent acquiring rhinitis medicamentosa. And if feeling mo you're experiencing it, you should go and see a doctor para mas ma-assess ka ng maayos and ma-relieve your symptoms as soon as possible. Before we end our discussion, here's our Bible verse for today. According to 1 Corinthians, chapter 10, verse 13, no temptation has seized you that isn't common for people. But God is faithful. He won't allow you to be tempted beyond your abilities. Instead, with the temptation, God will also supply a way out so that you will be able to endure it. Meaning, whatever you may be feeling right now is perfectly normal. You are not the first person to cope with it, and you definitely won't be the last. Be patient with yourself and trust that the Lord wouldn't put an obstacle in your path that you cannot overcome. That is all para sa ating Genius R special segment. I hope na may natutunan kayo sa aking topic for today. It is so very nice to share my knowledge with all of you. Have a nice day, stay healthy and beautiful. Peace out.